following production is a live procedure placing anterior kinder crowns, pre-veneered stainless steel crowns, on patients who were affected by early childhood caries. Dr. David Collier, DDS, a pediatric dentist at Koala Dental Care of St. Cloud, Minnesota, and a staff clinician at Gillette Children's Hospital of St. Paul, Minnesota, performs the procedure. The following sequence of procedural steps works best in my practice. However, you may prep how you feel most comfortable. Step 1. Select approximate crown size prior to preparation. Step 2. Gross reduction of tooth. Incisal, interproximal, buccal, and lingual. Step 3. Refine margins and remove any remaining decay. Step 4. Check for pulp exposure. If exposed, treat as necessary. Step 5. Verify crown by trying selected size and ensuring passive fit. Step 6. Fill crown with cement of choice and place on prep. Step 7. Confirm gingiva is reflected and crown is seated all the way. Step 8. Use Explorer and floss to clean up excess cement. Step 9. Use Prophy cup and paste to clean up any unseen cement. Step 10 is optional. If desired, use abrasive discs to characterize restoration by rounding off distal corners. During this procedure, I will be using regular length kinder crowns, but they are also available in 1 mm short. The length you should choose will depend on your preparation technique. In my opinion, it is best to consult with kinder crowns for help in deciding which length you will feel most comfortable seating. Kinder crowns are available in 2 shades, Pedo 1, a lighter bleached shade, and Pedo 2, the more natural-looking shade. I personally find that the Pedo 2 shade offers the best aesthetics, and that is what I will be using. I start my procedures by first selecting the crown size that best fits the tooth. This is done by holding a crown up next to their existing tooth. In this case, the patient's central is approximately a size 3 and the lateral is a size 4. This step can be skipped when you are more familiar with choosing crowns. Next, you begin your preparation. Preparation is very similar to that of plain stainless steel crowns, but it requires slightly more tooth reduction. This increased reduction is necessary to properly fit an appropriately sized crown, making the restoration as natural looking as possible. Based on my experience, you will need an extra 15 to 20% tooth reduction. In my initial preparation, I use a football-shaped diamond or an 855 tapered diamond, but again, this depends completely on your preference. I begin by reducing the incisal edge of the tooth. Next, reduce interproximally and buccolingually, decreasing the entire dimension of the tooth. During subgingival reduction, it is important to avoid damaging the gingival tissue. A flame-shaped diamond, such as a 368 or a 330 tapered carbide, can be used for the lingual preparation. These burrs can also create a nice feather edge or knife edge margin, which is recommended. Then, I remove any remaining decay with a slow-speed burr. With the increased reduction, you should anticipate more hemorrhage than in a regular stainless steel preparation. Hemorrhage and moisture control are not critical issues for these restorations as with strip crowns or window crowns. If you find yourself having to reduce too much subgingivally, you might want to use the 1 mm short length that Kinder Crowns offers to help alleviate that problem. Finally, check for any pulp exposure. If you find exposure, treat the pulp as necessary. In this case, the patient's lateral requires a pulpotomy. If there is no exposure, then go back to selecting the crown size. The most important key to remember when placing kinder crowns is that a passive fit is required. In other words, avoiding a snap fit is critical because it can create excessive pressure on the composite facing. When I was new to pre-veneered stainless steel crowns, I used regular SSCs to approximate fit, avoiding unnecessary stress on the composite facing. If the crown won't go to place without resistance, you will need to reduce more tooth structure to ensure a passive fit. After the preparation is complete and all of your crowns fit passively, the crowns can be filled with your cement of choice. Many dentists are using a resin-modified glass ionomer, but whatever you use with stainless steel crowns is fine. I personally use a glass ionomer and mix it slightly thicker than normal to aid in keeping the crowns in place. Once placed, make sure the cement is allowed to set according to the manufacturer's guidelines. Now I like to go around with a composite instrument to make sure the gingiva is reflected, because occasionally, crowns can pinch the tissue, particularly on the lingual. This step also ensures the crowns are seated all the way. Then I use an explorer to clean up all the excess cement. I also like to use a piece of floss with a knot in it to run interproximally, cleaning out any excess cement, maintaining healthy periodontal tissue. One of the features that I like most about these crowns is their thin contour, because it allows for high gingival acceptance. Next, go through with a regular Profi cup and paste to clean up any remaining cement you cannot see. I prefer ordering universally contoured kinder crowns rather than left and rights because it reduces the inventory I need on hand. Since that is the case, I like to go through with a soft flex type disc to characterize the individual crowns by rounding off the distal corners. That step is not necessary and is based upon your personal preference. Kinder Crowns offers great aesthetics, durability, and saves me valuable time in the operatory. And best of all, my patients and their parents could not be happier.
Hi, my name is Dr. David Collier. I'm a pediatric dentist here in the state of Minnesota. I'm speaking today on behalf of Kinder Crowns and their application in my practice. I exclusively use them now. I have used a few of the other systems out there, and I find that in terms of their ease of use, parent satisfaction, my satisfaction, and durability, they're at the top of the market. And in terms of patient satisfaction, certainly the kids do great, they look great, and it's overall just a very great product for me to use.